Hello, everyone, and welcome to Rehab Podcast Weekly. Today, we're diving into the topic pelvic floor muscle functions and dysfunction.
You know that little surprise leak that can sometimes happen when you cough or sneeze or maybe even during a really good belly laugh?
Oh, absolutely.
If that's ever happened to you, trust me, you are definitely not alone.
Not at all. It's actually really common, and it often points to something we don't think about much, day to day.
Which is?
The health of our pelvic floor muscles.
Right. Okay, let's dive right in then. Today, we're doing a deep dive into exactly those muscles, the pelvic floor muscles, and what happens when they aren't working quite as they should.
That condition we call pelvic floor dysfunction, or PFD for short.
Exactly. And our goal for this first part of our chat is really to give you a solid understanding. What are these muscles? Why are they so incredibly vital?
Yeah, the foundational stuff. We're looking at the basics today, and just so you know, we're pulling this from really reliable sources, clinical practice guidelines, solid health information articles.
Good. So let's get right to it. What exactly are these pelvic floor muscles we keep mentioning?
Well, think of them as a collection of muscles working together. The guidelines often describe them as forming a kind of supportive hammock.
A hammock. Okay.
Or maybe a sling right at the base, the bottom of your pelvis.
A hammock down there. Got it.
Mm.
So what's it supporting? What's sitting in the hammock?
Really important things. They provide crucial support for your pelvic organs. We're talking about the uterus and vagina in women, the bladder and the bowels in everyone.
Okay, so pretty essential stuff.
Definitely vital work, yeah.
And what are the main jobs these muscles do, besides just holding things up?
Well, their main functions are absolutely fundamental for just daily living. They control when you urinate and when you have a bowel movement, like the stopping and starting.
Okay, control.
And they also play a really significant role in sexual function. That's true for everyone.
Okay, and this is where it gets really interesting, I think. If these muscles aren't working right, if they're weak or maybe injured, what kinds of problems can pop up?
Yeah, if they're injured or weak, it can lead to a whole variety of symptoms. We mentioned the coughing thing.
That leak, yeah.
Right, urinary leakage is a common one, but it can also include leakage of feces or even gas,
Okay.
pain during sexual activity, something called pelvic organ prolapse, where the organs aren't supported properly, and just other difficulties with sexual function.
Wow, okay. That's quite a range. So we have a picture of where they are, what they do, but how can someone actually connect with these muscles? Can you consciously feel them?
You absolutely can.
Yeah.
It might take a little focus, maybe some practice, but you can learn to locate and engage them.
Huh. Any tips?
Sure. A practical way is to maybe sit or lie down first, get comfortable, and really try to make sure the muscles in your thighs, your buttocks, and your stomach are completely relaxed.
Just let everything go. Sometimes that's the hardest part.
It really is. But the idea is to isolate just the pelvic floor. Then try to gently squeeze and lift. Think about the muscles around your anus and vagina. Squeeze and lift them gently, almost like you're trying to stop yourself from passing gas. Or maybe stopping the flow of urine midstream, but we don't recommend doing that regularly.
Right. Just for finding the muscles.
Exactly. You should feel a subtle lift, kind of upwards and inwards inside your pelvis.
A lift. Like a little internal squeeze moving up.
Precisely. And just as important as the squeeze is consciously letting go afterwards, relaxing those muscles completely.
So squeeze, lift, then fully relax.
Yes. Try a few gentle squeezes and releases. The real key is making sure you're not accidentally tightening your bum or your thighs or sucking in your stomach. Those guys should stay out of it.
And what if someone tries this and they're just not feeling it or they're not sure? It's not always easy, right?
That's a really important point. It's not always obvious. If you're finding it difficult, if you can't quite feel that squeeze and lift, it's definitely a good idea to reach out.
To who? Like a doctor?
Your healthcare provider, or even better, a pelvic floor physical therapist.
Yeah.
They specialize in this. They can guide you maybe through something called pelvic health rehabilitation to help you learn how to effectively activate and, crucially, coordinate these muscles properly.
So it's not just about strength, it's that coordination piece too. That makes perfect sense. Now, how do these muscles actually, function in our daily lives beyond just holding pee and poop in?
It's actually pretty fascinating how integrated they are. One way I like to think about it is using a trampoline analogy.
Trampoline. Okay, I'm listening.
Imagine your pelvic floor muscles as a responsive trampoline. They naturally move up and down, subtly, in coordination with your breath. They work as a team with your diaphragm, that big breathing muscle under your ribs, and your abdominal muscles.
A breathing trampoline. That's a great visual. Can you break that down a bit more, the coordination part?
Sure. So think of your torso, kind of like a cylinder or a canister. When you breathe in, inhale, your diaphragm at the top of that cylinder contracts and moves downwards. This helps pull air into your lungs, but it also naturally increases the pressure inside your abdomen slightly.
Right, things shift downward.
Exactly. So to manage this pressure change, your pelvic floor muscles, the bottom of the cylinder, and your deep abdominal muscles, the side, should ideally relax and lengthen downwards and outwards just a little bit.
So the cylinder kind of gives way slightly at the bottom and sides.
Precisely. It accommodates that pressure.
Okay, I think I can picture that. And then what happens when we breathe out?
Then it's the reverse. When you exhale, your diaphragm relaxes and moves back up into its dome shape. As it does, the pressure decreases, and your abdominal and pelvic floor muscles naturally recoil, returning to the resting position and tone.
So it's this constant dynamic dance happening with every breath.
It really is a continuous, usually automatic coordination.
That's actually really insightful.
Yeah.
So understanding this breath connection, what's the main practical takeaway for people?
I think the key thing here is to be mindful of not holding your breath, especially during activities that put extra pressure down there.
Like lifting something heavy.
Exactly. Lifting heavy things, strenuous exercise, even straining during a bowel movement, holding your breath, bearing down. That puts a lot of unnecessary strain on these pelvic floor muscles over time.
And that could lead to problems.
It could potentially contribute to a weakness or dysfunction down the line, yeah.
A simple tip is often to try and exhale during the effort part. Like breathe out as you lift the heavy box.
Okay, exhale on exertion. That makes total sense. So beyond the breathing link and those primary control functions, what are some of the other really important roles of healthy pelvic floor muscles? Let's list them out.
Okay. Well, number one is that fundamental pelvic organ support we talked about, holding up the bladder, bowel, and uterus. Can't overstate that.
Right. The hammock job.
Exactly. Then there's the bladder and bowel control via the sphincter muscles. These are part of the pelvic floor group. They allow us to consciously control, the release of urine, feces, and gas. Very important socially.
Absolutely.
Right.
And delaying emptying when it's not convenient. Then, the flip side, when they relax properly, they allow for the passage of urine and feces. So they need to both contract well and relax well.
Okay. Makes sense. What else?
They play a vital role in sexual function. In men, they're involved in maintaining an erection. In women, they contribute to arousal and orgasm.
Right.
And as we just discussed, they're integrated with our breathing mechanics, relaxing to allow the diaphragm to descend. They also provide really essential support during pregnancy and childbirth.
Huge demands then.
Massive. And finally, they act as key stabilizers for our pelvis and lower back. They help provide core stability, especially during activities that suddenly increase that abdominal pressure, like coughing, laughing hard, sneezing, or lifting. They anticipate and brace.
Wow, they are involved in so much. It's really easy to see how problems there could have a huge ripple effect on someone's life.
Definitely.
Which brings us nicely to pelvic floor dysfunction, PFD. It sounds a bit, clinical maybe. What exactly does that term cover?
Yeah, you're right. The term might sound a little intimidating. And, as we hinted at earlier, talking about these nether regions isn't always easy for people, so PFD is often underreported.
People might feel embarrassed.
For sure. But essentially, pelvic floor dysfunction just refers to a whole range of problems that affect how these pelvic floor muscles work. This can include different kinds of incontinence, which is basically any involuntary leakage of urine or feces.
You okay?
And also pelvic organ prolapse, where one or more organs bulge down because the support isn't adequate.
And how common is this stuff? It feels like maybe something people just quietly put up with.
It is surprisingly common. For instance, some studies suggest that a really significant percentage of women, over 40, maybe even up to half, experience some degree of pelvic organ prolapse.
Wow, half. That's huge.
It is. And while urinary incontinence is also very prevalent, data suggests only a relatively small fraction, maybe less than 20% of those affected actually seek professional help for it.
That's a massive gap between prevalence and seeking help.
It really is.
Yeah.
And it's also really important to remember, while we often talk about it in relation to women's health, especially post-childbirth,
Yeah.
pelvic floor dysfunction definitely affects men as well. It's not exclusively a female issue.
That's a crucial point. Men experience this too. And how long do people typically live with these kinds of issues before maybe seeking help? Is it a long time?
Unfortunately, yes. The research suggests that many individuals live with symptoms for quite a while before seeking help. A large chunk, maybe close to half, report having symptoms for 1 to 5 years.
1 to 5 years?
Yeah. And another significant group, maybe over 40%, wait even longer, 5 years or more.
Wow. That's a long time to be dealing with leakage or pain or prolapse symptoms.
Yeah.
What kind of impact does PFD typically have on someone's day-to-day life?
The impact can be really significant and almost always negative. It can really affect their ability to just do everyday things, activities at home, at work.
How so?
Well, maybe avoiding exercise or social situations where they worry about leakage or planning trips around bathroom access. It can impact intimate relationships, limit their social lives,
Yeah, I can see that.
and it definitely takes a toll on overall mental well-being. Studies have actually linked PFD to higher rates of depression, social isolation, and anxiety. It really chips away at quality of life.
It sounds like it can really erode someone's confidence and just their enjoyment of basic life stuff.
Absolutely. And beyond that very real personal impact, there's also a pretty notable economic side to pelvic floor dysfunction.
Economic. You mean like healthcare costs?
Exactly. It's tricky to get exact numbers for everything, but think about the direct costs.
Yeah.
Buying pads or protective underwear, paying for diagnostic tests, treatments, maybe surgery.
Okay.
But then there are also indirect costs, things like lost wages if someone needs time off work for appointments, or if their symptoms affect their productivity or ability to even do their job comfortably.
Right, so it's broader than just the medical bills.
For sure. And unfortunately, with populations generally getting older, these costs, both personal and societal, are projected to keep rising.
That really puts the significance of this issue into perspective. Okay, before we wrap up this first part of our deep dive, can we briefly touch on what might make someone more likely to develop PFD? What are some of the risk factors involved?
Yes, definitely. There are quite a few known risk factors, and some are specific to men or women, while others can affect anybody. It's also generally true that the risk can increase with age for both sexes.
Okay, so age is one factor. What else?
Well, for men, a really notable risk factor is having had prostate surgery.
Ah, okay. Makes sense.
For women, common factors include, besides age, any direct injury to the pelvic floor muscles, maybe during childbirth. Pregnancy and childbirth themselves are major factors. Genetics might play a role, possibly lower socioeconomic status, interestingly, and having had a hysterectomy.
Okay, quite a few for women. What about factors that apply to both men and women?
Yeah, there are several. Things like direct pelvic trauma from an accident, say. Any condition that chronically increases pressure in the abdomen, like a chronic cough from smoking or lung disease, or habitual heavy lifting without good technique.
We talked about lifting earlier.
Exactly. Also, chronic constipation and straining. Engaging in really vigorous physical exertion repeatedly without proper core engagement can be a risk. Obesity is a significant factor. And even having a history of back pain seems to be linked.
So it sounds like a pretty wide net of things can contribute. We've certainly covered a lot of ground today.
We really have.
From the basic anatomy, that hammock idea, and all those functions.
Breathing, control, support, sex, stability.
Right. All the way to understanding what PFD actually is, its prevalence, the kind of impact it can have.
And touching on those risk factors, too.
Yeah. I feel like we've built a really solid foundation for understanding this crucial but often overlooked area of our health.
I agree. Understanding the what and the why is the first big step.
So just to summarize then, what are the key takeaways you'd really like our listeners to hold on to from this part of our deep dive?
I think the main things are, 1, realizing just how crucial these pelvic floor muscles are for so many basic bodily functions and our overall well-being. They do a lot.
Definitely more than people might think.
2, understanding that pelvic floor dysfunction, PFD, is actually common, and it can really significantly impact quality of life. It's not just a little problem.
And shouldn't be ignored.
Exactly. And 3rd, knowing that there are various identifiable risk factors that can contribute to developing these issues.
Absolutely. And this is just part 1, setting the stage. What's next?
That's right. In our next deep dive, we'll get into the practical side of things, how PFD is actually assessed and diagnosed.
Excellent. Looking forward to that. So maybe something for you, the listener, to think about before then. As you go about your day, what everyday activities might be influenced by your pelvic floor health in ways you hadn't really considered before this chat?
Or maybe, what small proactive steps could potentially contribute to better pelvic floor health down the road?
Good questions. Definitely something to ponder. And be sure to join us for the next part where we'll delve into how pelvic floor health is evaluated and what comes next.
edited by Min.Rehab. Thank you all for listening, and see you in the next podcast.